So just a little bit of like very brief introduction for me. So I've been a functional medicine doctor for 29 or 28 and a half years, which is really weird for me to say that, right? For it to be that long. My original degree is as a doctor of chiropractic. My first year in practice, I actually focused on weight loss. I was a personal trainer before being a doctor. And in a clinical setting, it's different when people came to see me in weight losses versus at a health club setting, because in a clinical setting, a lot of people, they had already done all different kinds of diets and different ways of exercising that. So it forced me by necessity, but it was also my interest to actually get really good initially at doing a very detailed testing of thyroid. So many people, so many women get such a like surface level testing of thyroid and they're told that it's okay. And when in functional medicine, we always do more detailed, we find that there is some aspect of thyroid that's contributing to their fatigue or weight gain or whatever's going on for them. And then after that, very quickly, I had to get very good at doing a detailed testing of female hormones because it was more women that I was seeing at the time and still do. And so things kind of snowballed from there. Eventually, I got a postgraduate degree in clinical nutrition. I have a practice in Elk River for quite a long time. I have two other doctors that work for me there. They're trained by me, so they can do all the same stuff that I do, so people don't have to see me necessarily. I've am so into the lab testing that I actually have taught other healthcare providers functional medicine testing. I've created a software that are used by providers around the country where they can take lab results and put them into a program to create a report that we'll look at here too. So this is a very, very big part of what I do as well. I was looking back about 10 years ago, I was doing a lot of kind of community like education, like just to teach people things. And one of my most popular seminars was called Mastering Hormone Balance for Women. And I did it about 15, 20 times in a couple year time frame. It was very, very well attended. And I even had a lot of women tell me they wish their teenage daughter would come to learn the stuff that a lot of times apparently women just are never taught some of the stuff too, right? And one of my favorite parts of doing those was when people would ask questions. So I felt the format for today would be fun is just for you guys just to ask questions, let you guys kind of direct the conversation based on your questions. And I can just talk for hours on different stuff, but it's more fun for me to talk about stuff that you ask questions about too. So with that in mind, I guess I'm sure we'll talk about hormones and thyroid and female hormones. We see a lot of things with fatigue, autoimmune, digestive issues, pretty much anything that you want to talk about as well. So who wants to be brave and start with a question of something?
We'll be brave.
Okay.
I would. So I've been like submerged into like Gary Brecka and all,
Yep.
all about that. Oh shoot! I forgot to turn this off. I'm sorry.
Mm-hmm.
Just all the biohackers about longevity and all that. But the common message with all of them is you can't just bypass all the foundational things, which is in your lane too.
Mm-hmm.
But I guess my question is, what do you think about estrogen and in women and the
Mm-hmm.
depletion of it and the supplementation or the balancing out or the supporting of that as women age? Because I've heard a lot that, gosh, even in your 30s, it can really start to deteriorate, and the medical profession just doesn't seem to want to go there that much.
So the story on estrogen is recently changing. Out. Any of you saw any news like press releases or whatever, which is very exciting actually. In that the the original thinking and the mindset medically is that estrogen has the potential to be harmful, right? Or it can be promoting of cancer. It's kind of been the common theme. And now they're coming out and saying that that's actually not the case, right? And so estrogen is certainly we think of as women go into menopause and there are the menopause symptoms, whether it's hot flashes, night sweats, mood changes, we most closely tie that into estrogen. But keep in mind that as all women go into menopause, it's not just estrogen that drops down. It can be all the hormones. It could be progesterone, testosterone, DHEA, and they all play their different roles of what's going on, right? And so the kind of game of hormone balance is not just an estrogen game. It's just as important to know what's going on with progesterone. And in fact, in our clinic, I probably look more closely at progesterone. It's interesting that progesterone, we can only, let me rephrase this, if we were to only recommend, let's say, a natural bioidentical progesterone, we can get an estrogen-like effect because progesterone makes your cells and tissues more sensitive to the estrogen that's there. So we've had many women where just by doing natural or bioidentical progesterone that they were able to get relief of their hot flashes and night sweats. But that's not going to be every woman. Some women actually, they need the estrogen. And when you get estrogen tested, it's really, there's three main estrogens. There's actually more than three in the body, but there's three dominant ones that are within the body. They're labeled E1, E2, E3. And so it's estrone, estradiol, estriol. And the estriol is referred to as the healthy estrogen because it can help promote weight loss, it can reduce autoimmune, it can reduce inflammation. The estradiol is kind of the strongest of the estrogens. That's the one that's most typically recommended medically. They'll do like a estrogen patch or something like that. So if we have women where we're doing all our stuff, some women, their hormones are just dropping so severely that maybe they do need to do a stronger estrogen like that as well. So I don't know if I answered your question though.
Yeah.
Yeah? Okay.
I have a follow-up question.
Yeah.
I'm sorry.
Got
the microphone.
Oh, right.
Yeah.
Follow-up question.
Yep.
Because we're on the subject of estrogen, and so I think it's a two-part question.
Mm-hmm.
Number one, so what do you recommend for somebody who, like me, who has had an hormone-positive cancer and is on aromatase inhibitor that I'll be on for 10 years?
Yeah.
So I have very little, if none, estrogen in my body right now, and boy, do I feel it.
Yeah.
So can you still balance other hormones, or do you recommend still? Because I think I haven't sought out help because I just feel like, oh, I have this sentence for the next 7 years and I'm going to be miserable. So is there still help that you can do? What does that look like? And then how do you feel about hormone support for somebody who has had hormone positive cancer?
Mm-hmm. Yeah, we've had several women over the years come in where they've had breast cancer and tested estrogen sensitive. And so to be on the safe side, I will, we'll do all our hormone testing. And for me personally, I'm comfortable recommending a natural progesterone. But technically, I say clear this with your medical doctor first, right? And that can even be tricky there too. If that's not an option, there are herbal things that can be done. One of the best research is a rhubarb extract that they find, and you can actually get this in like supplement form. I don't remember the exact name of the extract, but it's a rhubarb extract where in some research it can be as effective as doing an estrogen as well. So getting relief of, getting like an estrogen-like relief doesn't have to be estrogen. It can be other things that can get that done too.
So you can help.
Mm-hmm. Oh yeah.
John,
Yeah.
show them this
Yeah.
chart because
Yeah.
you guys are probably smarter than me. I didn't realize we had all that going on.
So what I tell a lot of patients, and we can pass this around if you can't see it too. I think what I might do is I might even put this chart on our website. So just for the sake of the video here too. So healingchoices.com, there'll be a tab for education. I'll put this on there for a called hormone chart, so anybody can look at it that way too. The tendency we see of a lot of providers, mainly medical, some natural, when they test for female hormones, is they will test only progesterone, maybe one kind of estrogen like estradiol. And we certainly want to know that, but if you're only testing those couple things, we're missing other really important pieces of how our body creates these hormones. So not a lot of people know, for both men and women, the precursor to all the hormone creation when it comes to the sex hormones is cholesterol. So we need to make sure there's enough cholesterol there in the first place. And that typically is not the problem. Most people have enough cholesterol, if not maybe more than enough. But every now and then somebody is low in cholesterol too. And then before cholesterol can convert down into things like progesterone and down the pathway, cholesterol first has to become this hormone called pregnenolone. and not a lot of people have heard of pregnenolone. Even fewer get it tested, which is really unfortunate because it is the precursor to all this other hormone creation. So pregnenolone is interesting because it has a little bit of anti-inflammatory benefit. When pregnenolone is quite low, and when I finally got around to checking my pregnenolone, I was tested quite low. And when I started taking pregnenolone, because you can supplement just like you can other supplements, within that first week, I lost like 8 or 9 pounds, and I didn't do anything different. And my only hesitation in saying that is that won't be for everyone. That was just that was yeah. Right? You're all on your phones, right? Where do I get this? But so there's a percentage of people where it will be like me. It fixed a pretty strong weak link in my hormones and then just in my metabolism, right? But again, that won't be everybody. But there's really good research on pregnenolone and how it's protective towards the memory areas of the brain. So having healthy pregnenolone is preventive against things like dementia and Alzheimer's as well. And it's unfortunate it's like never talked about. At least patients we see, a lot of them never even heard of it before. And then from pregnenolone, it branches off a couple different ways. From pregnenolone, it can go to progesterone. We're always looking at progesterone. Progesterone, of the things that it can do, has kind of a calming effect to the mind and to the body. So if a woman is struggling with being more anxious or even to the degree of anxiety, low progesterone can be a piece of why that's happening. And so getting more progesterone has that calming effect to the mind and to the body. I've had many, many women comment that they don't sleep so well, and once we get going with some natural progesterone, it's obvious to them that they're sleeping better, which is a really big deal because the longer you go with getting poor sleep, that will wear anybody down no matter how healthy you are. It's going to wear you down over time. Yeah. Right? Yeah, that's hard. Of the different hormones for female hormone balance, we think of progesterone as kind of the fat-losing hormone, or the one that's more related to losing the ability to get your body into a fat-burning mode as well. And then, so that's kind of one direction of pathway. We go the other direction. Pregnenolone goes in the DHEA. DHEA is often referred to as the anti-aging hormone. If you get into articles and stuff, or just look up online about anti-aging, DHEA comes up quite a bit. And that's because it's a precursor then to testosterone and estrogen as well, and all the estrogens too. Testosterone, I would say, is not talked about enough with women. The benefits are very similar for men and women in that testosterone ties into mood, energy, behavior. Testosterone certainly is one of the first things we think of when there is low sex drive or libido. We think about just the ability to keep healthy muscle in our bodies as we get older. So not in like a bodybuilding sense, but just keeping good muscle in our body so as we get older, we have good mobility, good function of our body. Testosterone plays a role with that. And for some women, testosterone being too low is one of the things that can be the barrier why they're having a hard time losing weight too. So in our practice, because testosterone is so heavily regulated by the FDA, because it's been abused for so many years by bodybuilders, stuff like that, we don't have the ability to help with that. The way that we affect that is by improving DHEA, which is the precursor that will convert down the testosterone. But some women definitely benefit from doing testosterone therapy for sure. So it can make a big difference in how you feel. And then in the pathway, it's hard to see for you and even probably in the camera, but in the middle here goes down the cortisol. We care about cortisol. A lot of the conversation of cortisol are when levels go too high and how this can be a barrier also for weight loss. We think of cortisol being the stress hormone. So as a person is under more stress, your adrenals will produce more cortisol. That cortisol helps your body adapt to stress. We also care about cortisol and really any hormone if cortisol goes too low, because cortisol is one of our body's best ways of keeping inflammation under control. And so if cortisol goes too low, that gives opportunity for inflammation to start to go on under control, which then does its own kind of long-term harm as well. So cortisol, like cholesterol is not the bad guy, cortisol is not the bad guy. It's just that if it's at the wrong level, then it can be a bad issue, right, as well. So,
Do you feel it's even reasonable for anybody to start jumping down lanes without having more of a functional thorough blood panel, unlike what the medical profession does.
I've had so many women that we've seen where they get put on some kind of hormone therapy and they don't even do any testing, right? Yeah. And it's like, how do you know the starting point? And then, like a classic example, I was mentioning to someone here, we had a gal that was in just recently who was given the pellets for testosterone, and her testosterone was like crazy high levels of testosterone, right? Which any hormone too high or too low can be a bad thing, right? There's kind of a sweet spot that people want to be in for their best health. And so, I guess, what was your question again? Sorry.
Well, I mean, is it fair or kind of a waste of time to try and self-correct or jump through hoops or supplement without just getting your baseline blood panel outside of the standard medical?
Mm-hmm.
Because we know that's all very surface level.
Right. And one of the frustrations that I have, and I think people have, is medically they kind of like compartmentalize a lot of things, right? And they don't look at how things are connected in that sense. And so that's the benefit of doing a broader panel of testing, because it's not as simple as just saying, oh, you need progesterone, you need estrogen. For example, a lot of people don't know you need enough thyroid hormone in the system for your body to properly utilize the female hormones. If, let's say, a fasting insulin, if insulin is elevated, we call it insulin resistance. And that dominance of insulin will have a blocking effect. And so even if there's enough hormone there, of female hormones, your cells and tissues can't utilize it because all the receptors are dominated by all this insulin in there too, right? So easily you'll get a better effect if you look at more things and don't just be like, oh, you're low in estrogen, just take this and let me know how you feel, right? For sure. And then technically, so there's a couple things. Hormone replacement therapy is not as simple as just taking a hormone that you need. There's also the receptors of the cell. So think of the cell receptor as what receives the hormone to connect to the cell and gives the information of what that cell to do. The receptors need to be receptive. So if there's too many toxins within the body, that will have a blocking effect on the receptors. Again, there can be enough hormone there, but they can't get their job done because the receptors, the environment is too many toxins in there. Also, critical nutrients for those receptors to be active are things like magnesium and zinc and certain B vitamins. So we get into deficiencies now that play a role. So it's definitely more complicated. Certainly, if a woman were to only do estrogen to get relief, she's probably going to get relief. Hopefully, she's going to get relief because that's the whole point of it. But she's probably not going to get like balance. It's only as good as she's taking it. She goes off it, and then things are going to go down again, right? Another thing a lot of people don't understand is in the short term, even in our clinic, we will do natural or bioidentical hormones to get quicker relief of symptom. But the long-term success for all women for hormone balance is having good adrenal function. So as all women go into menopause, again, it's not just estrogen that drops down, it's progesterone, testosterone, all that. And so the backup to the ovaries are the adrenals. And the problem is the adrenals, of course, are also our main stress handling gland. So if there's been enough stress in a person's life prior to going into menopause, the adrenals can already be weakened or fatigued, so that when you go into menopause, the ovaries shut down. The adrenals don't have their capacity to kind of take over and pick up the slack. So hormone levels drop even faster, and these are the women who get the most severe symptoms when it comes to menopause, because their adrenals were already kind of worn down due to stress even before going into menopause. So it's definitely okay to do hormone replacement in the short term to get levels back faster, to get faster relief, because you have to sleep, you have to function, right? But ultimately, the ideal scenario is at the same time to take time to work on building up the function of your adrenals. And the adrenals, the tricky part is the adrenals tend to take longer to improve and function because, again, they're our main stress handling gland. So we can be feeding the right nutrients, feeding the right things to build up the adrenals, but we all still have stress in our life, right? And so there's that kind of competing process going on. And so it just takes a little bit longer to get the adrenals better versus somebody comes in and their thyroid or liver are struggling. We can, within a few months, we can get that better. The adrenals, not always, but typically take a little bit longer. It requires a little bit more patience. So the point is, if you are or end up on some kind of hormone replacement, and if you don't want to have to rely on that the rest of your life, then you want to be thinking about, what do I need to do to get my adrenals working better? So at some point, they can be functioning better. They can be producing hormones better for you. So you have to be taking it externally all the time too.
And even in menopause or post-menopause, you think you can support your adrenals?
Oh, yeah.
Okay.
Yeah.
Wow.
Yeah. It just takes a little bit longer. Yeah. But you can do that.
What about the studies that say that, taking estrogen, not necessarily in the first year, but after that, like long term, that helps build bone density and those kinds of things? Would that be a reason to continue on the estrogen?
I would say if it was testing low, yes. But in theory, if we can get the adrenals working better, then we have better production inside the body. But estrogen is definitely not the bad guy either, right? Because women, men need estrogen too. It's just different levels. But women need enough estrogen for bone density. It's related to cardiovascular health. It's related to brain health. It's there for a reason. And so, really, I think maybe the point is, if you're not testing, then you're just kind of guessing at things, right? And so, it's finding someone who is able and willing to do the right testing. Sometimes that could be your medical provider, but we get a lot of people that come to us because their medical provider won't do it, right? Or they won't do it to the level of detail that it should be done. And that's kind of a common theme I see with women that come into our clinic is a lot of times they've shared their symptoms or their concerns with their medical provider. Either they feel like, unfortunately, that person is a little bit dismissive to them about what's going on, or maybe they have an awesome medical provider, but they've just kind of done what they're going to do. They're not going to dig any deeper. They're not going to do anything different. And functional medicine, it's all about the digging deeper to get more to the root of what's going on as well.
So I'll say, when I first met with John, I think it'll be 3 years now in April, when I finally, he'd been telling me for a while to come in and see him, and I just didn't make time, which I want to talk about time and scheduling at the end too. But not only did I not understand all the hormone stuff, when he was first showing me all my red categories, I'm like, holy crap, John, I don't want to be on a ton of different pills. Well, what he educated me on, well, no, you just have to take this, and then he flipped through the pages, and it'll help this, this, and this. Like, I didn't know that. I thought, if this is low, I got to take that. This is low, I got to take that. And it's not.
Yeah, part of it is about prioritizing, because there are people who come in who they can have like a ton of stuff wrong, and it has to be realistic. It has to be a program that people can follow, right? And so it's all about taking what's going on and prioritizing. And it is true that a person can come in and they can have like a dozen or more different symptoms or health issues. Almost always there's a lesser number of things underneath that's branching off and becoming this, this tree of all different kinds of things that are going on as well. And so it's just going to someone who knows how to dig deeper and get more to the roots of it, right, as well. So, yeah.
I have a question.
Mm-hmm.
My thyroid was killed off.
Yeah.
So I have been told that I need to be on a T3 and a T4 for the rest of my life.
Mm-hmm.
Is that a true statement? Or is that Western medicine to get it on a pill?
No, I don't think they're just for the sake of prescribing you something. I don't think that's the case. So thyroid is definitely, I talk about some areas that have a domino effect. Thyroid is definitely the domino effect. The thyroid has the nickname of the great mimicker because some people, they have all these issues and they're going to all these different doctors only to end up finding out it's actually the thyroid is one of the primary things that are going on. And so one of my frustrations is most women, if they are, let's say, whether they have their thyroid killed off or whatever, like you said, or maybe they're identified as low thyroid, or maybe they have autoimmune thyroid, so Hashimoto's, what that's called, lower thyroid function, they're put a lot of times on levothyroxine, which is a generic form of Synthroid, right? And then the frustration is that which in terms of thyroid hormone is a form of thyroid that we call T4.
That's the other one. Cytomel.
Yep, cytomel is the prescribed form of T3. Yep. So the problem is T4, which is what your thyroid mainly produces, is the form of thyroid hormone that we refer to as T4, actually doesn't do that much to affect your cells and tissues. It really doesn't do that much to determine your metabolism, energy production. It's not until T4 gets converted into T3. So the thyroid produces mainly T4. A lot of that conversion into T3 takes place within the liver. So now we talk about association. So now we have to have good liver function in order to have good conversion into the free T3 to then have good energy and good metabolism. A little bit of that conversion takes place within the digestive system, a little bit within kidneys, so we have other organ systems that can affect that too. So I will tell people the rest of my life, and I always tell them that of thyroid testing, the free T3 will always be the most important test. And it's the one that frustrates me, doesn't get tested as often as I think it should anyways.
So I do get that one.
Yeah.
Twice a year.
Nice.
But I still have issues.
Yeah. So that gets into another thought that when labs do lab results, and medical doctors will look at this, and not just medical, other doctors, providers, even natural ones too, if the result is within the lab's reference range, they'll say it's normal, right? However, most labs provide a reference range that can be a very wide range of what they're saying is normal in function, which does not represent what's really best or optimal for function. And so again, in functional medicine, we purposely look at results in a more narrow range of what we know to be best or optimal. So specifically for free T3 in functional medicine, we want it to see for anyone to at least be at 3.0. It's easy to remember because free T3, at least at 3.0 minimum. If there is a goal of weight loss, we'd like to see free T3 in the mid to upper 3 range, even a little bit in the 4 range would be okay too. And so you'd have to go back and see, in your prior testing, if it's down into the 2 something for the free T3, then that could be why you're still not feeling the best for your energy and that as well. Yeah. And a lot of women, we've seen women who've been on thyroid medication for a couple decades, they've never had their antibodies tested. And they never knew that they had an autoimmune thyroid as well. And so there's a different thought process about autoimmune. We can kind of go into that a little bit too for autoimmune. But just know that if you're concerned about thyroid and going to any kind of doctor or provider, I would pressure them, or if there's a way to make them do it, make sure they're testing the free T3. Super, super important to know what free T3 is as well.
With the autoimmune, there is that perception that there's a lot of things that can be labeled under that umbrella.
Yeah.
But from the Western medicine, it seems like they just say, oh, it's autoimmune, but they don't know what the cause is. Like, how do you wake up one day and then this happens? I mean, that's what the core of functional medicine is, of course. Do you think a lot of the autoimmune things can be corrected by going deep into this stuff? So
I think the reason why a lot of women don't get the antibodies tested for thyroid is because medically they don't really have any tools in their toolbox to fix it, right? And this is true of most autoimmune, especially if it's something that's more severe, like a rheumatoid, or there's all different kinds of ones that could be more health or life affecting. And if they were to do something, then almost always it's going to be some kind of a medication that will suppress the function of your immune system. So that will reduce the autoimmune reaction, and then reduce the symptoms a lot of times of the autoimmune. But if you're taking a medication to suppress your immune system, you're not just suppressing towards the autoimmune, you're suppressing towards anything the immune system does. So now you become more susceptible to cold, flu, COVID, pneumonia. You suppress your immune system, increase the chances of cancer, and this is all on their labels. It's all there if you want to read the fine print too. But from a functional medicine perspective for autoimmune, what I explain to people is that most people are not born with an autoimmune. So something changed within your body at some point in time where the immune system said, or decided that it wanted to go after some kind of normal tissue. Could be anything within the body, right? So typically before that abnormal autoimmune reaction happened, usually the immune system was initially reacting against something else first. So it could have been chemical, heavy metal. We do a lot of toxic heavy metal testing at our clinic, looking at all the different, mercury and just a whole big list of different heavy metals, toxins within the body. And so it could be with that toxicity in the body, there's partly an immune response to that toxicity. And then from there, it crossed over to become autoimmune within the body. Or it could be a food allergy sensitivity, where it started with that. The immune system was kind of reacting to food or a food group, and then it crossed over to something within the body. Or it could be some kind of either past infection or chronic infection. Classic example for autoimmune thyroid is for viral, specifically Epstein-Barr virus. And they're actually finding Epstein-Barr virus is not just thyroid. They're finding it's the culprit for many different kinds of autoimmunes because it's a virus that it's tricky. It likes to hide away. And so the body can't get rid of it. And then it kind of reemerges. It kind of like recedes and reactivates and is causing a lot of problems that way too. And so we think about what was the immune system reacting against first? Because if we can identify that, get that out of the body, because that and the autoimmune are like this paired or joint reaction. It's hard to get the autoimmune to recede or go into remission if we don't deal with what causes it to happen in the first place, right? We also think a lot about digestive function, specifically if there is what's referred to as leaky gut. And essentially what that means is normally in the intestinal system, the intestinal cells are tightly held together. But if there's enough imbalance, if there's enough inflammation or things going wrong, it can start to create these little microscopic gaps between the cells of the intestine. And now things are getting absorbed into the bloodstream that normally shouldn't get into the bloodstream. And the immune system looks at that, thinks it's like a foreign invader, so it starts to create an immune response. And then from there, it crosses over to autoimmune. Another thing not a lot of people know is the importance of blood sugar regulation and autoimmune. So if there is an autoimmune going on of any kind, if a person has more instability of their blood sugar control, it's going to be very hard to get that autoimmune in remission if we don't get the blood sugar under better control in its function too. So and that's a very simplified explanation. There's more than that to think about, to go after, to actually get a person to reduce the autoimmune reaction, if not get them in actual remission. It's possible really for anybody, for any autoimmune to get into remission. You just have to do the right stuff, right? Not that it's easy either, because this is getting pretty detailed, and people, they have to make some bigger changes to diet and stuff like that too. Getting back to hormones, one of the reasons why women are more likely to be diagnosed with an autoimmune compared to men are because of the hormone differences. Typically, the scenario is that either there is an excess of estrogen, or what we call estrogen dominance, or a lack of progesterone to balance out the estrogen. Whether it's one or both, that kind of positions the immune system to more easily become overreactive to things as well. And so to reduce autoimmune, there can be a hormone piece that ties into that too. Yeah. So when you get into the details, it can get a little bit overwhelming for anyone, right? And so that's the whole point of going to a functional medicine provider is we know these things, we can do the investigation and break it down. And then again, it's back to prioritizing what are the most important things to work on as well.
How often do you test a menopausal, postmenopausal woman, and everything looks great?
Well, almost, pretty much, basically never, because they're coming to us because they have symptoms and issues.
Right.
So it just increases the chances there's stuff going on as well. So yeah, there are times when we do like the more detailed blood lab testing where it's like, oh my gosh, this person, their vitamin D is okay, and this is okay. It's like their thyroid. This is I haven't seen thyroid testing this good in a long time, and so it's a pleasant surprise when we come across that. But it's pretty rare because people are coming to us because they're not feeling good, right? So
I just wanted to bring the energy level up a little bit.
yeah,
I
sorry.
was like,
Yeah. Yeah.
What about for young gals, like in their
Mhm.
mid-20s, young 30s that have issues with like digestion, gut issues,
Mhm.
fatigue,
Mhm.
irritability, depression, anxiety?
Yeah.
What are their hormone levels look like typically?
It's interesting. I've had women come in, or I've even had teens come in, but I've had women come in to say that their hormone issue started like right when they started having a period. Things were not normal, right? So that can be the case. And that's such a big deal because hormones are such a controlling factor to brain and metabolism and just everything that's going on too. And so I guess it's kind of a broad question that you had there. I'm going to lead into digestion though, because that's a big deal. Yeah.
My daughter went through that. Sophie went through that.
Yeah. So we, I think, are fortunate that we help a lot of people with all different kinds of digestive issues. I'm just realizing that someone's watching. Bye.
Mila's here too.
Yeah. And so it's, I'm happy we're able to help so many people with all different kinds of digestive issues. But again, I'm frustrated because in one way, I feel like we're kind of the last resort for a lot of people. We've seen a lot of people who they've already been to multiple gastroenterologists, and it's fine that they do their endoscopy and colonoscopy, all their scopes and tests and whatever. It's all good testing to do, but at the end of the day, a person's still not feeling good. And so the way we investigate is differently. The primary method we investigate for digestive imbalance is through what's called a comprehensive digestive stool analysis. So it's a test kit that we provide to the patient. In their own home, they gather 3 small samples of their own stool over 3 different days. And they just box it up and they ship it through FedEx. It goes to the lab. And the lab looks at everything that we want to know about the health or the environment of the gut or the intestinal system. So it looks at, are there enough of the good bacteria? I just call them the good bugs. People will think of that as the probiotic. Is there an overgrowth of the wrong kind, which can lead to people getting diagnosed with things like SIBO, if you've heard that term before. SIBO is an acronym for small intestine bacterial overgrowth. So basically, it's just a bacterial overgrowth of the wrong kind of bacteria. I'm surprised how often we find that someone will have actually a foreign bacteria that's gotten into their gut or intestine, and they actually have an intestinal infection. I'm surprised that that's not found before they come to me. I'm happy I find it, but yeah.
I'm so sorry that you were taking a pause. I was going to
Go
jump in.
ahead.
Is that would that be like a parasite, or is that something totally different?
Well, so the testing does look at many different kinds of parasites or parasite-like organisms, but I was talking about more like a bacterial infection. Yeah. It also looks at an overgrowth of yeast or candida, which is actually very, very common. It's normal for a small amount of yeast to exist within your intestinal system. It does serve a little bit of a purpose, but many things can happen that will kind of knock down the good bugs, and then these things like other bacteria, candida yeast, it creates opportunity where they get a foothold and they just start to cause a lot of problems. That kind of testing also looks at how well you digest in your foods, how well you absorb in your foods. Is there inflammation in the gut? Is the immune system working okay? And other things too. So it's a very, very good testing. And in reality, if gastroenterologists were to do this kind of testing, they would help so many more people. But that's not where their thinking is at. So if they keep doing what they're doing, I will never have a shortage of patients, basically, right? Which I'm happy to help people, but I want people to get better faster too. It frustrates me because I think some people, they've had like intestinal infection for probably years, and nobody's found it, right?
So what are the symptoms of that?
A variety. It can be kind of your standard of, just your gas, bloating, discomfort, definitely abnormal bowel movements, whether it tends to be more on the looser stool side. It can be anything that disrupts digestion. When you're not digesting well, that increases the chances of things like heartburn and reflux as well. Many people are on like reflux medications. And the irony of that is most people, if they get heartburn or reflux, it's not because they're producing too much stomach acid. It's very rare that somebody's overproducing stomach acid. But yet the medical treatment is to take a medication that will suppress your stomach acid production. Often they're not producing enough, and so they're not digesting their foods very well. this food is sitting in this warm, dark, moist environment, and it actually can start to go rancid or putrefy or ferment and produce its own organic acids that start to back up. And that can be the heartburn or the reflux. There's other reasons why heartburn and reflux will happen, but that's very common. Help a lot of people with reflux. Of culprits for reflux, when we think about foods, I would put gluten at the top of the list as a trigger. I've seen patients where they, just by removing that one variable, they were able to go off the reflux medication. But that won't be everybody, right? But it can be that big of a deal. So somebody, one second. So somebody who, I tell people, the more severe their digestive issue is, the more likely I'm going to recommend to do both the stool testing and also a good quality food sensitivity testing, because that food sensitivities can mess things up a lot too. Yeah.
No, I was just going to say, are there general just dietary things that you recommend for everybody?
We do have like a basic minimum recommendation of things. We call it the Ultimate Food Guide. It breaks it down to different food groups and what are the best choices of within that group. And this document was designed actually not by me. It was another company, and we just kind of borrowed it, I guess. But it's designed for people who they have issues with blood sugar control, issues with inflammation, or they have issues with acidic body chemistry. So if your body chemistry gets too acidic, that creates an environment where bad bugs can get in there and kind of messes things up too. So from that, the way that we get more specific with food is to do a food sensitivity testing, because that will tell us what foods both their immune system is reacting to and what foods are triggering inflammatory response. There are a lot of companies nowadays where anyone can go to. You don't even have to go through a provider. You can just have the company send you a kit, provide some kind of a sample and send it to them, and to do testing for food sensitivities. The problem is most companies will only test for the immune system reaction, which we do want to know that, but the testing that we do looks both at the immune system reaction and the inflammatory reaction, because many people, it's just as important to know what foods are triggering inflammation as well.
That is a really important
huge.
differentiator, because I've done the one, and by the way, it was very accurate on the two things. I was like, these two things don't show up. I know it's not right. And so I know it was accurate in some ways.
Yeah.
But that's really interesting. Yeah.
So they're getting helped by doing only the immune system testing, right?
Yeah.
But so many people, they have the uncontrolled inflammation. I myself, when I did genetic testing, learned that I have genetic variants that result in my body creating inflammation more easily. And so therefore I have to think a little differently, or maybe do things a little bit differently, because inflammation has that nickname of the silent killer. The longer inflammation goes on, these inflammatory chemicals are reacting with your cells and tissues. You think about all these severe chronic diseases of the elderly, Alzheimer's, really bad heart disease, really bad arthritis. A lot of this began as inflammation earlier in life that was never identified and never dealt with. So inflammation is a big, big deal.
Do you find that with the food sensitivity testing that a lot of the things that are the top markers for people are the things that it's not in moderation, like they eat all the time, or is it random?
No, so just for the sake of the camera, I'm going to kind of repeat the question. So the question is it typically things that people are overeating, would you say? Yeah. I would say, ironically, we tend to crave the foods that we're sensitive to. And this has been shown in research, it's like this allergy addiction kind of syndrome that takes place. My best analogy for that is that if somebody were to start smoking, which maybe we all tried it when we were kids, I don't know. But the first time you do it, it's probably not a very pleasant experience. But if you're determined to keep doing it, eventually your body will adapt to it. So now your body has adapted to the negative presence of this thing coming into the body, right? So that when you stop doing it, your body is still adapted into the presence of this, and then therefore it wants to crave you back into it. That's part of the craving. Obviously, nicotine is very powerful too. So my analogy is with food. So let's say somebody is, and this is me as a kid, I was 2 big glasses of milk every meal. I'd be drinking milk between meals, and I didn't know any better, right? And it turned out to be like I'm still, to this day, I'm still sensitive to milk. And so when you're eating something, your body wants to adapt the best it can. It wants to do the best it can in the presence of whatever you're putting into it. If it's a food that the body's reacting to, it will adapt to it. And so you're kind of in this adapted state. So if you remove it for a little bit, it wants to be in this adapted state. So it's going to have you kind of crave it to kind of pull it back in, so it doesn't have to readapt as well. But eventually you go without it, and then it will readapt again. It's kind of maybe a more lengthy explanation there, but but it is true that the more a person is eating of something, the more likely it can show to be something that they're sensitive to, or maybe it's a more severe reaction. Specifically, if there's also leaky gut as well, because with leaky gut, again, it's kind of these microscopic gaps between the cells of the intestine. That food particle, before it's been fully digested, or it hasn't been fully digested, so it's a little bit larger than normal food particle, gets absorbed into the bloodstream, and the immune system looks at that and says that that's not normal, and then it will start to create a reaction to it, and that becomes the immune system reaction to a food. Yeah.
Do you think there is anybody that doesn't benefit from intermittent fasting? Or, I mean, do you see that it is beneficial for most people to contain their eating maybe within 8 hours of 24 hours, or whatever the ratio is?
Yeah, so intermittent fasting, I think a lot of providers who are knowledgeable would say that would be a good thing for a lot of people. I would say specifically if there is issues of insulin resistance or blood sugar issues, that can be a faster way to bring under better control. Insulin sensitivity as well. You could argue even beyond that we would all benefit from doing even longer fasting time frames, right? If you get into the information about it, you'd say in intermittent fasting, the benefits really start to happen around like 16 hours, and then from there the benefits increase beyond that as well. And so if that's the goal, do intermittent fasting. Not that everybody can start at 16 hours, between meals. Maybe you can only do 10 or 12, just start at that. But then it's really once you get towards 16-hour time frame of not eating, so then you have the 8 hours where you are eating. That's where you start to kind of get into the stronger benefits of that too.
Well, that's even is like a 3-day fast kind of extreme for most people.
Well, I think a lot of people would feel extreme.
Yeah.
But many people have done that, if not longer, right? It has to be done carefully. It has to be done, you're getting enough water, you're getting enough minerals. It has to be done in a smart way. But again, so think about it this way. If your body is not having to expend energy with digesting all the time, then that frees up energy for other things like healing the body and detoxifying the body and balancing hormones and all that kind of stuff too, right? So there can be a big advantage. In some cultures, it's like very, very common that they will incorporate a fasting strategy into their lifestyle as well. Just not really part of our society as much right now. Yeah.
How do hormones at our age play into sleep? Because I have a really hard time. I have insomnia, I would say, or within 6 hours, my body just wakes up.
Yeah.
No matter what time I go to bed, it's like within 6 hours, and I have a really hard time falling back to sleep, and then that impacts me and I get overtired. It's brutal.
The two main things we think about, because we hear about this quite a bit too, is if the difficulty is it's hard to initially fall asleep, one of the first things we think about hormone-wise is cortisol. Cortisol has a 24-hour rhythm, so cortisol is normally highest in the morning, and we want that because cortisol is kind of this natural stimulant, so we want cortisol to be higher in the morning, and then it should kind of drop down and taper down throughout the day and be among its lowest late in the day as you're trying to calm down and go to sleep. Some people, and cortisol again comes from adrenals, they have kind of this dysregulated rhythm where cortisol is maybe increasing, and so now it's giving you that stimulating effect just like it does when it tries to wake up in the morning, right? So that's one piece of it. When the issue is, so falling asleep is okay, but then the issue for many people is that they will wake up during the nighttime, and they can wake up and be literally wide awake, where they can be awake for a couple hours or more, and then they calm down to go to sleep, and then a half hour later their alarm goes off. So they're never really getting a good night's sleep, right? Very frustrating. And so what we find most often is that's because there's instability with blood sugar control. So when you're sleeping, you're kind of doing like kind of a mini fasting in a way, assuming you're not getting up and eating during the nighttime. And so what happens is as you're not eating during the nighttime, blood sugar levels will start to drop down. And if they drop down too low, because that glucose is the fuel for the brain doesn't like it when blood sugars drop down too low. And so the brain will first tell your adrenals to produce cortisol, which will have a mild effect to bring blood sugars up. And if that doesn't get the job done, then your brain will tell your adrenals to produce adrenaline, which is one of the most stimulating things your body can produce when you're trying to sleep. And again, that's what wakes people up, and then they're wide awake. Like literally, they could probably even just get up for the day. They're so wide awake, right? And it takes a while for them to calm down again. So a simple thing you can do to see is the waking up related to blood sugar getting low is before you go to bed, and literally 15 minutes before you go to bed, have a small, healthy protein or protein healthy fat snack. And so what that means is, and it's not a big thing, a serving, but if you look at the size of the palm of your hand, so you take away the fingers, if you have a leftover protein from a meal, do just half the size of the palm of your hand. If you have leftover chicken or something like that. Especially if you combine that with a healthy fat, you could do olive oil, or you could do coconut oil, or you could do avocado oil, or whatever. So by getting protein and healthy fat before you go to bed, because it takes longer to digest and absorb the calories of that, it allows blood sugar levels to be more stable for a longer period of time during the nighttime, and you're less likely to get that to drop down as well. So if you did that to some degree every night for a couple weeks, you'll know by the end of the couple weeks if that's the culprit of that too. Not everybody has a leftover of a protein, so technically you can do like a protein powder, like people do the protein shakes. I wouldn't. Yeah, protein. Yeah, definitely. Yep, could do a hard-boiled egg. That's the easy one if you already have it ready. Yeah. Still wouldn't be bad to throw in like some kind of healthy fat thing along with it too.
That's funny because I do avocado a lot in the evening. That's what I had for dinner last night. Eggs and avocado and my olive oil.
And so with a protein powder, it's okay to do that in that same way to see if that helps keep your blood sugar levels more even during the nighttime. I wouldn't do a like full serving of a protein. I'd take, if it's like 2 scoops, then just do 1 scoop. And don't, do it with water. Don't do it with like some kind of almond milk or whatever, because it's going to have some sugar or carb in there. You want to keep it really ideally no sugar, no carb for that little snack before you go to bed as well.
And does magnesium ever play a role in sleep?
Oh, yeah. Yep. So magnesium of the different minerals definitely has more of a calming effect to the mind and to the body. Magnesium of the different minerals, magnesium is the most common mineral deficiency, like across the board of our society, right? So magnesium is involved in energy production. It has connections to hormone balance. We talked about receptors of the cells. There needs to be enough magnesium for the cells to be receptive to hormones. Magnesium ties into brain function, specifically short-term and long-term memory. Our brain needs enough magnesium, and they've done good research on this, that getting magnesium, and there are many different forms of magnesium. There's only certain ones that cross into the brain. But magnesium will show improvements in both short-term and long-term memory, which I think everybody likes the idea of that, right? We think about magnesium a lot when it comes to muscle function. Our muscles need enough magnesium to relax properly, and so people who struggle with just chronic muscle tightness, or if it gets to the point of actually like Charlie horse cramping in their feet or calf muscles, if you wake up during the nighttime because your feet are all cramped up, that is probably either magnesium deficiency or a person is just too dehydrated as well.
Does that help with like restless leg?
It can. We think of restless leg more of things like iron deficiency or of the B vitamins, specifically folic acid as well. Yeah.
So is it better to take magnesium in the morning or at night?
It's good to take either way. Typically, if we're doing testing and somebody's low in magnesium, we have them take of a daily amount. If you want to get into what's like more of a therapeutic amount, we're getting around 500 milligrams. But you can't take that all at once because you just can't absorb that much at one time, and it can be a little bit stimulating. If you get too much magnesium, it's going to loosen your stool or upset your stomach, right? So then we do a morning dose and an evening dose. All minerals, doesn't matter what kind, you typically will digest better if you take it with food. Because when you're eating, that's when your stomach acid is going. And it's in your stomach with enough stomach acid where you're able to break down these minerals. So think about a mineral natured like this hard rocky substance. Think of how strong the acid has to be to break that down into its smallest particles so you can actually absorb it, right? But people will still, and I will sometimes take magnesium before I go to bed, and it's still going to help. But if you're looking at the best digestion, it's going to be with food. That too.
So aren't there different kinds of
I was just gonna say, is
Yep.
it glycinate? Like, what do you take? That's
Yeah.
the confusing part.
So yes, that's a good question. So best magnesium glycinate. Magnesium glycinate is going to be your best kind of all-purpose. So if you're not sure what to take, glycinate easily be the one to take, right? Something like a magnesium citrate. Some people will kind of go towards that, but that one's more likely to upset the stomach or loosen stool. And so I want to be careful with that one. If you're getting into the brain benefits and the memory benefits, then you're getting into like a magnesium L-threonate. So, or it could be called Neuromag, but that's one of only a couple forms that will actually cross what's called the blood-brain barrier. There, our brain is designed to prevent things getting in easily, and so there's only certain forms of magnesium that can actually get into the brain as well. So ultimately, all-purpose, one of the easier ones to find though, if you're not sure what to do, glycinate, hands down, would be the one to go for.
What is calm? Citrate?
I'd have to look at it. I'm not
I
sure.
think it is. I used to take that, and then I changed to glycinate.
That's what
I changed because of that. Yeah.
Yeah. Mm-hmm.
Do you recommend a liquid vitamin or vitamins versus like a tablet? Because I know sometimes your body doesn't always digest those as well as maybe a liquid.
Yeah, you could argue if you go from like tablet to powder in a capsule to liquid, you could argue that some will be easier to digest and absorb, but then you're also getting into just how's that person's digestive system even function in the first place. We'll have patients that'll come in who they just have a hard time swallowing pills or capsules. And so then we, as much as we can, we'll try to go into more liquid, or a lot of times the capsules, it's a powder in a capsule, so you can open it up, you can mix it in. Can't guarantee it's going to taste awesome, but at least it's you could take it that way and not feel like you're swallowing this larger pill as well. Yeah. Yep. Mm-hmm.
When you were talking about the fluctuations of blood sugar and the fluctuations of cortisol, are there tests that you don't just send in a blood test and it's done because it's, in the morning you would have done the blood test without eating a fasting test, or does it test it throughout the day to see what's actually happening?
So when we do our larger blood panel, we call it a super panel. So it looks at all the female hormones, looks at all the thyroid, all the hormone stuff, and a bunch of chemistry stuff. You're right in that it is only testing cortisol in the morning, right? And cortisol has a rhythm. Cortisol normally is at different levels at different times a day. So if we want to or need to get into knowing what that rhythm is, then we default to, it's called a saliva cortisol test, where it's a test kit that we give to a person, and they're gathering 4 saliva samples over a day's time. So we get a sampling at different points of the day, and it's easier to kind of graph out and see what's going on, including late in the day before they go to bed, because again, if cortisol goes too high late in the day, it can be too stimulating and make it hard to fall asleep too.
What do you think about like some of the things like the Aura Ring and that, that do tracking of things? Do you think those are accurate? Are they beneficial? Much information?
Yeah, I know of them. I just don't know a lot about them. So I'm not so much an expert on that. I know people like them. We have employees in the clinic that have them and they like them. I don't have any experience with them though, as well. So I don't have a good answer on that one. Mm-hmm. I'm getting you all bummed out with all the stuff that potentially could go wrong, right? So I guess the moral of the story is that pretty much anything we find, it can be fixed, right? And so it's knowledge is power, and doing the right investigation, the right testing to see where things are at gives you the knowledge and the power to make the change as well. But the problem a lot of people have is they're not getting the right testing done, and you're entering in too much guesswork of stuff too. And functional medicine is all about the detail, taking out the guesswork as much as we can.
So I have a question.
Mhm.
It's a bold question.
Okay.
I experience functional medicine, and if I'm going to spend my money, that's where I'd rather spend it.
Mm-hmm.
These days, my mind has changed over the years, and what I struggle with is you go to a functional medicine doctor, and it'll be there's X thousand, and we'll treat you for X weeks, and then after this, we're not going to talk to you anymore, and we need to get another 10 weeks or whatever. Is that how most functional medicine doctors work, or is that? I don't know. I've only been to one.
Okay.
And I've done research for others, and some do it that way, and I don't know how does your clinic work?
So most functional medicine in general, unfortunately, is not covered by insurance, which is our frustration too, right? And so we do have a lot of people, they have like HSA and whatever, which can cover that as well. So the way that we work in our clinic, it is for pretty much everybody, the first 3 months, it's a monthly fee, but we're extremely reasonable. If you're talking thousands, we're not that. So what we charge right now, I'll just give it to you, is for the first 3 months, it's $395 a month, each month for 3 months. And that covers all time, all appointments, all communication. Doesn't cover the cost of testing though. Testing is separate, right? But what we do in our clinic for testing that people like is most of the tests we recommend, we do not mark up the cost. We have you pay the lab directly to get better pricing. We can do this because we've been doing this for so long, we're extremely efficient at it. We don't have to spend hours looking at a person's information to know what's going on, right? And so people will come and talk to us and they'll say, oh my gosh, that seems like a lot. And that's all, you know what? Please go shop around, because I already know that we are more reasonable and we're a lot more thorough in terms of what we do with people as well.
So then, to Brenda's point, kind of follow up, after that 3 months, then how does that look?
Yeah. So typically it's one of two scenarios. Let's say we do the initial testing. Let's say it's like this broad panel of testing of hormones and chemistry and whatever. And a person has a lot of things going on. And then at the end of 3 months, we'll go back and we'll do a smaller panel of testing, just kind of rechecking what was abnormal. And we see that things are better, but there's still enough going on where we feel like we still need to be more accountability. We need to be checking in more often to make sure that things are going well for them. Then what we do is we still do a monthly fee, but we cut it in half at that point. So now we're down to like $195 instead of $395. Or more often, at that point, after the 3 months, we already have a good handle of what's going on. We know the person, they're doing a good job of being compliant, and they're doing what they need to do. They're taking the supplements, and we don't feel like we need to do as much hand-holding, kind of following them. Then we just go down to where they pay for the office appointments as they come in as well. So it's whatever is going to help them be successful, also whatever is going to be more cost-effective at the same time. I and the clinic very sensitive on pricing of things. You get to a point where you don't want to be pricing people out of the ability to get help, right? As well. So
supplements and I assume supplements is not covered.
No, it's all
supplements and labs are in addition.
Yep. So we break the fees down into 3 categories. There's the fee a person pays for service, fees for testing, and then whatever the recommendations typically would include certain supplements or nutritional products, but there are ones that will be extremely specific to each person based on the results of testing, right? And that's its own separate fee as well. So this is why we never just do the same thing with everybody, and because everybody's so different, right? You can't charge, some places you go to, they charge like a flat fee. This, to work with us, you got to pay $5,000. It's like, well, what for? Right? Some people don't need that level of care as well.
So for me, after all the initial stuff with John and talking to him a little bit more and giving me what I'm going to take, doing my blood work and meeting with him, now I've done blood testing 2 or 3 more times, and every time he's had to just make a minor tweak, and it was noticeable. It was very noticeable. One of them had to do with how I was absorbing sugar, and it's kind of like an onion, wouldn't you say, as you start getting healthy, and we just change as we go.
Mhm.
But then, yeah, you just pay when you have to go in and see him or what you're changing. So can they, because I think I started to talk to you a little bit about script. So he's in Elk River. He's on this end of Elk River, and the convenience of it too.
Mhm.
I know you say you initially like to see face to face, but after that, I know you'll do Zoom
Yeah.
or whatever.
Yeah, we can see people remotely. And technically, I've had patients, I've never met them face to face. It is nice. I think it's nicest when we go over the initial lab results because it's quite a bit of information. It's nice to do it in person. I feel like people understand better, but it can still be done quite well through video. I wouldn't do phone. I'd do like a Zoom, like a video. Can share screen that way too.
So how far are you from here?
I can get there in, well, I would say it should be 20, probably 5 minutes. I can get
So that means she can get there in 15 minutes.
You've drove with her and you've been on boats with her.
Can the lab order ever be pushed through your primary clinic?
Yeah. So let's say like a common starting point is to do this more thorough blood testing of hormones and chemistry. From our perspective, it actually doesn't matter where the testing gets done. So we have patients that'll come in, we'll just give them a list of what those test items are, and you're welcome to take that to your medical provider to see if they're willing to do that testing, which can be a good way of doing that, especially if you're looking to get it billed to insurance. As long as you know you have good insurance coverage, as long as you know that you do not have deductible as well. Because if you have deductible, then nothing's covered until you pay out of pocket. The comparison is with this larger blood panel that we often start with called a super panel. To do that same testing through a medical clinic, it would easily be billed either to insurance or maybe potentially to you at a rate of about $2,000 to $3,000. Because they bill at such high rates when it comes to any kind of testing. That same testing, we have a lab that we work with and get the exact same testing done for $299 as well.
And they charge like
That's
$30
all.
to do the draw. So
Yeah.
I always go
I tried to submit
kind
a
of, yeah,
panel
kind of, yeah.
through insurance and they declined over 90% of it. It's not even worth it.
But $299 is fantastic.
It's a very good price.
I mean, I would have to ask you what the price was, but
Yeah.
And you
I was
an FSA
getting
or
encouraged.
Mhm.
cover that, right?
I've never seen it not covered. We have a large percentage of patients that use HSA.
And I had him give me the list of what to do because I was going in for my annual, and I'm not going to swear for you recording, but he crossed out literally almost 2/3 of what I wanted tested and said, "Oh no, you go down rabbit hole. You don't
Yep.
need this."
Mhm.
I was furious when I left, and I'm not saying that would happen with you. Try it,
Mhm.
but
I think that's the challenge is because I was and saw you when I don't know, maybe it was a year and a half ago. The pain point wasn't great enough for me to be diligent on the execution of the plan.
Mm-hmm.
Now my pain point is greater, so I feel like my motivation level is much higher. Like, okay, I'm going to do this, but I remember the advice of take this test back to your provider and see if they'll rewrite the prescription of the Armour Thyroid to be a little bit more. And they wouldn't. They
Right.
just wouldn't do that because
Wow.
even though their optimal range is, their range is like this, and it's like I might skate 1 point over that.
Right.
They're not looking at optimal. They're just looking at, you're in the range, so
Right.
why would we do that? Even though
Right.
I'm showing you this right here, so.
It's very, very challenging to, and I'm, I want to kind of clarify to say there are some awesome medical doctors out there too and providers as well. But that is generally the feedback that we get from a lot of people is the frustration.
Who it's not them, it's who they work for.
Yeah.
It's the
Yeah.
insurance
how
company.
insurance
Exactly.
is. Yeah.
Yeah.
no,
They're,
it's their training, their education. A lot of them have like Austin Fowler this morning. He's a new medical doctor. He did 2 weeks on nutrition. He
Mm-hmm.
said, how about menopause? They just left on maybe a week.
Mm-hmm.
That's my married.
Lymphedema, 2 hours. That's what I was told.
So I had a similar.
So I know what
I mean, this was with my gynecologist, and this is years ago now. But it was a little bit of the same scenario. Is they don't normally test ferritin,
Mm-hmm.
which is an iron store. They always test hemoglobin, right? But they don't test ferritin.
Mhm.
And my gynecologist said, you know what, I'm going to test your ferritin because you've had this, fatigue, hair loss, blah, 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 blah. I'm going to test your ferritin, which I'd never heard of before. And they tested it, and I got a call like a few days later. Okay, you need to get on iron supplements like immediately because your ferritin's at 12,
Mm-hmm.
which is super low. And again, you said the range can be like this,
Mhm.
and that range is like that, right?
Mm-hmm.
But I went on my supplement or that iron, and it changed it changed everything.
Yeah.
When I started telling people about it, and theirs was low. But
Mm-hmm.
if you say to your gynecologist, I want to have my ferritin checked again this year. Well, why? Why do you want? Like they argue with it
Right.
or about it, and it's like, well, because I've had bad low ferritin.
Right. It shouldn't be that hard,
No.
really, to get even some simple testing done. But I don't know why it's so hard. But again, you go to a functional medicine doctor who knows what they're doing. You don't even have to ask for it. It will just automatically get put in with other things you maybe haven't even thought of having tested before as well. Iron is interesting because some people, some women, even if it's just like a mild amount of iron deficiency, can just be very affecting of like energy level and how they feel as well. And so definitely you want to get the iron and the ferritin along with hemoglobin. Get that all. You don't have the full picture unless you're doing all the testing of things.
Yeah, and my hemoglobin was just fine.
Yeah.
It was my iron stores that were bad.
Yeah.
Really, really low.
On the other side of that, there are more people than I think I should see that have where the ferritin is actually too high. There's actually a genetic condition that results in excess iron storage. And excess iron gets stored in organs like liver and other parts of the body, and over a long period of time does damage. People who have this genetic condition where they store away excess iron in the form of ferritin, they actually have a shortened lifespan because of how much damage that extra iron can do over time too.
What are the symptoms of that?
Um,
Not too much.
would be, it's almost like it's a silent thing. You wouldn't really know. Yeah. It probably would flow into like liver and cardiovascular problems, but then they're getting treated for those things, and they're never getting themselves tested to know that it all started with excessive iron storage as well. Yeah, there's not like an obvious symptom with that.
So interesting.
I have a question going back to what Terry talked about, the
Armor thyroid.
armor thyroid. That's the natural. Is that the
Pig.
That's like the original kind of, if you want to call it natural, from a natural source.
Correct.
Yep.
So, what is the difference? I mean, I've heard about that one, and then I hear about Synthroid or Levo. Is it Levo?
Yeah.
And I mean, is one better than the other? 'Cause the one I take is synthetic.
Yeah.
Correct.
With levothyroxine.
Levo.
Yeah, that's a man-made form, synthetic form of thyroid hormone, of T4.
And I've always
specifically.
heard that.
That's the one
Armor-
that most will push. They will push the synthetic one.
Correct.
Yep. Because that's what insurance covers.
Exactly.
Right. So one way to answer that is I've seen many women who were either on Synthroid or the generic of levothyroxine, and either through my recommendation or maybe on their own, they were able to talk their prescribing doctor into going on Armor Thyroid or Nature Thyroid or similar ones like that too. And when they switched, it was very obvious to them that they felt better as well. Thyroid, even medication-wise, thyroid's a little bit tricky because different ones or different combinations are going to work for different people as well. So it might be one person does fine on levothyroxine, the generic, and then the Cytomel, the synthetic T3. Maybe another person does better on the non-generic, on the Synthroid. They can tell they feel better on Synthroid versus levothyroxine, but it's hard for doctors to prescribe Synthroid because it's often not covered by insurance, which will cover the generic, right? And so now we're back to insurance companies kind of dictating what the providers can or are able to do.
Not the body.
Right.
Working with your doctor.
Right.
Because I am in that situation where I feel better on the Synthroid,
Mm.
but the Synthroid is not covered.
Yeah.
So I have to be on the Levo. And
Right.
if I want the Synthroid, I have to pay the out-of-pocket.
Right.
And so that's
Right.
it's a tough one.
I pay a lot more. I mean,
Mm-hmm.
I think a three month supply is like $180, but I'll pay that because I've tried the synthetic one a couple times over the last, I don't know, 15, and I feel terrible. So it's worth. I mean, you kind of have to balance that out. Is it worth it, or it is
Right.
too bad that.
180 over 3 months isn't horrible though. Sometimes the difference is like,
Oh yeah,
Yeah.
I mean yeah.
And then it's
that-
like-
right.
30-day
can't.
medication
Then
is
you just
$2,000.
it's cost prohibitive to
Yeah.
do that versus like $6 for that.
So I
But if
they
you
pay
went in-
180 for 3 months.
right.
Like one medication is $2,000
Yeah,
for
I'm-
a 30-day supply.
Right.
So we're not taking it.
So it's just it's so unfortunate that
Mm-hmm.
it's like that, and you know that in other countries they're not billed like we are here. I mean,
Right.
we're just taken so advantage of in this country.
Yeah, and there's a lot on the functional medicine or natural side that can be done to improve, because we have a lot of women that come in who are on medication for a long time. They still don't feel good. So there's things that we can recommend naturally to improve how their thyroid is functioning, improve how you're converting T4 into T3, because again, T3 is the game, right? That's the main player. We care about the free T3. Keep in mind too that we live in a part of the country in Minnesota where we don't have as easy access to ocean foods, and so it's more common for us to become iodine deficient. So we talk about T4 and T3. What does that mean? T4 is 4 molecules of iodine, T3 is 3 molecules of iodine. So iodine is like the base ingredient needed to create thyroid hormone. And so some women do very well by getting the right form of iodine, which helps not just thyroid, it helps adrenals, it helps hormones. Iodine in the body, well, iodine is used medically as like an antiseptic, right, to kind of prevent infection. So having healthy iodine levels in your body can also be like an antimicrobial to prevent you from getting sick so easily too.
So some of the stuff you could recommend would help her to feel better with the medication that
Yeah.
her insurance is covering.
Yeah, basically make.
I'm just curious. No one's ever tested my iodine.
Mhm.
Not that I'm.
Was that part of the test?
Iron. That's iron, right? Is iodine and iron?
Nope, two different things. Yep. So we it's not part of our standard panel, but we can always add it in if we need to. Yeah, or if we want to.
And if you went in for a blood, like lab work, like for, like I'm on cholesterol medication, so I have to go in for my heart stuff.
Yeah.
Could I say, could you add iodine to my
To your with your medical provider, you mean?
yeah, and just
Oh.
add that onto the lab list?
You can try.
I mean, I really tried to have them do so much.
Yeah.
I mean, I'll go for a whole CBC, but then remember when all the vials were short during COVID, they couldn't do much.
Oh.
They were like, they were short on vials, so they could only do like so much.
Oh,
So then it's like, but yeah, I'll have them do a whole CBC because I want to see white blood, red blood, whatever,
here's another little known connection that will apply to you and probably a lot of people is there's a direct correlation between the amount of thyroid hormone in the body and what's going on with cholesterol. So if you remove any other variable, if you only look at cholesterol and thyroid, as thyroid hormone levels drop down, you will see cholesterol increase. Or if cholesterol is high and if thyroid hormone is low and you work towards getting it to be at a healthier level, that one factor alone will allow cholesterol to come down more easily too. So there are easily millions of people that are put on a cholesterol medication when in reality, if they would get their thyroid tested properly and get their thyroid hormone levels better, they probably would not need to go on a cholesterol medication. There's other
And I've heard
other factors too.
cholesterol medication is not good for you, which I mean, I really would like to get off it, but
Yeah,
it's not.
right.
Like, that's a whole nother.
So yeah, some people, some
That's your
I
step.
support him there because I wanted me to go on cholesterol, and I said no.
mhm,
And I started seeing an endocrinologist for my thyroid, and that's when I got the T3 and the T4,
mhm.
and they got my numbers where they needed to be, and then he had a flat-out conversation with me and said, "You gotta lose weight. Now this is on you." And so I worked with him and did that, and I'm not on it.
Okay.
But I'm still on the thyroid, and they say I'll be on that.
The longer you're on it, because it's kind of overriding and taking over for your thyroid, your gland's production. So the longer you're on it, think of it like it's replacing. It's almost like your thyroid gland is kind of slowly kind of shriveling up and becoming less and less active. Well, yeah, that's true. Yeah, so because of that, you will be on it the rest of your life, right? That makes sense. Yeah. Some people on cholesterol medication, they do not feel good. I've had patients. I had one guy tell me a while ago, as soon as he's taking the cholesterol medication, it's like it messed with his brain, and it's like his memory was going and recall, and nobody wants that to happen, right? Especially as you get older. Some people they get a lot more achiness in muscles and joints and that when they're on cholesterol medication too. So cholesterol is interesting in that. Where do I want to start? So cholesterol, the original research in cholesterol that was done decades ago found what we all hear about, that high cholesterol, there's consequences. It could be cardiovascular consequences. That original research, what we don't hear about is there's also consequences when cholesterol is too low. And it helps understand what cholesterol actually does within the body. So we already talked about how cholesterol is the precursor to all this hormone production. Cholesterol is incorporated into the cell membrane, the outer layer of all your cells and tissues within your body. It's part of that outer membrane, to keep the cell healthy. Cholesterol is actually a pretty decent antioxidant as well, which means that it helps to protect your cells from getting damaged or can repair cell damage. So when cholesterol goes too low, whether it's done on purpose by medication, and there can be other things that can cause it to go too low too, you don't have that same protection of cells. So it is known that low cholesterol increases the chances of getting cancer as well.
What types of cancer?
Well, any kind. Yeah. Yeah. Did I just bring y'all down a little more?
Yeah.
It's like,
Well, look at the time.
you're like, how do we get them out of here? That's the worst thing. So, but it's all, I guess, I go back to the idea that, yeah, it can feel like a lot of negative things like we're talking about, but everything is fixable. You have to know what's going on, and then once you have the information, it can be fixed, right? So
Everything you promised.
Question on fixing thing. So I'm going to take like an example that I think the medical profession just chalks a lot of stuff up for like, oh, it's aging, it's part of aging.
Mhm.
And I know some of you with amazingly thick hair will not get this, but there's
Yeah.
a lot of us that have my age that are thinning hair.
Mhm.
Like my hair is noticeably getting thinner.
Mhm.
So do you feel that having a panel that can be corrected or like stalled out
Mhm.
versus going on a mega supplement like Nutrafol or some of those that are amped up with biotin and all these other things?
So hair loss for women actually comes up quite a bit, and so the two most likely reasons, well, the number one is going to be there's a thyroid problem going on. And again, these are women who they get only TSH tested, and TSH can look fine, and they're told their thyroid's okay when it's not, so it has to be tested better to know. If we do a thorough testing of thyroid and it's looking good, the second most likely thing gets in the female hormones, or specifically low progesterone. Very often it's a combination of the two. If, let's say, it's not those, then we get into more deficiency like the Nutrafol or other products that have, biotin, that could be helpful too. But you could take products like that, and if you have a thyroid problem or low progesterone, it would be very limited. Those kinds of products would even be helpful.
What they can do.
Yeah. Yep. So I've seen many women, I've had women come in there wearing wigs because they were losing so much hair. And then we identify, typically thyroid, progesterone, or both of those, work on getting that balanced. And it kind of goes from, I'm no longer losing clumps of hair, and then, so that stops, but then things start to reverse. It takes a little bit, because it takes a little bit for new hair growth to come back, so it's not like everything's better the next month, right? But but then you tie into that, more recently, COVID. People had the really bad COVID, that because the body, then there's so much stress. Think of your hair from your body's perspective. There's essential systems and non-essential systems. So essential are things like your brain and heart and lungs, right? Hair is not essential. So you get under enough stress, and there's only so many resources to go around. Your body is going to prioritize and make sure the essential will survive at the sacrifice of the health of your hair, at the sacrifice of your hormones, at the sacrifice of the health of your skin and nails and all the stuff that your body would feel is non-essential, right? So
what do you think about marine collagen and taking that for hair?
Yeah. I think,
that's
So-
what I started losing my hair, a lot
Mhm.
of my hair. And
Yeah.
I started supplementing marine collagen and putting that in my coffee.
Yeah.
And it seemed to help marine collagen. It just-
Yeah. So collagen from a fish source versus, yeah.
Yeah, it did help. It did help.
I read about it.
Yeah.
And it did help, and it helped, like, so my gut is really sensitive, so I didn't want to do, like, bovine, so I went
Yeah.
to marine collagen. It seemed to help my hair.
Yeah.
I just put a half a scoop in my coffee in the morning,
Yep.
and then I'm good.
It makes sense because collagen is part of skin, hair, and nails. It gets incorporated into bone tissue and the muscle. It's incorporated into so many tissues, right? Collagen actually can be very beneficial when it comes to leaky gut or helping to heal the gut as well. So there's like multi-level benefit of something like that.
Yeah, so that's what I started.
Yeah.
You've actually seen a reverse of somebody who's literally, because my one sister, who is literally she's like completely bald.
Yeah.
I don't know how else to explain it. She's
Yeah.
got I think I'm the only person outside of her husband who's seen her without her wig on, and literally burst into tears because it felt so bad. And I also, I'm on minoxidil because I'm so freaking afraid I'm going to do it. So you're saying that it's possible if she got tested. She did get tested at the dermatologist for her thyroid,
Okay.
and they said it was normal.
Depends on how
No, I'm
well,
curious.
right? Yep.
So I'm like, it potentially progesterone and thyroid.
Yeah.
You're saying it's possible. It could come back.
Most commonly, it's going to be one or both of those that are like the culprit of that. There is a lesser common scenario where there is an autoimmune condition that attacks the hair follicles, alopecia. Right. And so, but I would think if they go to a dermatologist, I would hope that they would test for that in some way.
I would hope.
Usually they'll actually get they'll actually cut a sample of skin and send it to a lab and then kind of investigate that way. So, yeah. But that would be really, of the possibilities, that would be at the bottom of the list. Yeah. And that would not just be head hair, that would be hair anywhere in the body in that autoimmune.
Oh, yeah, no, I think she's hairy other places.
Yeah.
I mean, seriously.
That's interesting though.
That's interesting. Yeah.
When you talk about collagen, are there any that you recommend just across the board? Because there's so many people trying to make money off of collagen right now. And there's so many different kinds of collagen.
There's you have your collagen, type 1 through at least 5. There may be more than that, but 5. There's like type 1, type 2, 3, 4, 5, and each type has a benefit to different areas too of the body. Like pretty much all supplements, there is a huge variety of quality based on the manufacturer and how careful they were in actually creating the final product as well. So I don't have like one that I think is the best one necessarily, but I guess in that one you could argue you get what you pay for in that sense too, right? As well. So we have one in our office that's extremely good quality. It has all the different collagen types within it, but it's kind of pricey. It's like $80 for a container, which is pricier than a lot of things as well. But
How long does that last?
it's probably like a 30-day, I would guess.
Mine's like $40 for 2 months of last.
Yeah. Right.
It's not bad. Like it's worth it.
Yeah. Or, if you're trying to figure out quality of any supplement, then it's nice if the company they create a batch of something and they will send it to an independent lab to be analyzed to make sure that it doesn't have contaminants, that actually what is on the label is actually in the product, right? So you can have not perfect confidence, but you can have more confidence that the quality is going to be better if they do like certified, independently analyzed as well.
Does it have to be on the label? Or how do you know if it is?
Well, typically, if a company is going to go with that effort because it costs them money, it'll either be on the label or it'll be on their website that they're doing that because they it's like they're proud of it. They want to make it be announcing it to people that they're going through this effort to make sure the quality is good.
What about mold in things like peanuts or coffee? What's your take on that?
Yeah, so that's very real. And part of it is not just exposure. It's some people are more sensitive to exposure of things too. And this could be not just mold, it could be heavy metals, it could be anything as well. Where you and I use the example more with heavy metals like, let's say mercury as a toxic heavy metal. You and I can be exposed to the same amount of mercury, and maybe your body, you're just like genetically, naturally a better detoxifier. Your body does fine, maybe mine doesn't, so it stays within. My body, our body doesn't want this junk just to be circulating, wreaking havoc the whole time, so it's going to push away into different tissues and kind of sit in the background and be like the source of, over time, more and more problems as well. But yeah, but mold is definitely an issue in some foods as well.
So he gave me a binder pro that you take at night and it's supposed to help grab and push that out.
Yeah, so heavy metals specifically, the process to remove is referred to as chelation. It's just the term chelation to do that. There's many different kinds of chelating ingredients. There's even the degree of doing an IV chelation, which is a more aggressive way of doing it. I tell people the analogy with getting rid of heavy metals, I will say it's the turtle that wins the race. If you go after it too quickly, too aggressively, you can not only push somebody into like a detox reaction where, detox symptoms can be headachy, fatigue, upset stomach, more achiness in muscles and joints, kind of skin issues as well can happen. But what's unique about heavy metals is if you go after it too aggressively, it can be stressful, maybe even damaging on certain organ systems as well. So in my opinion, you're safer going slow, steady, gentle when looking at getting rid of heavy metals as well. We do a testing. It's a urine test. You just take it home, provide a urine sample at home. The lab will test for about 20 of the more common heavy metal toxins. Among the different ones, consistently aluminum comes back as the most common one as well. Aluminum is hard on the thyroid. There's good research on aluminum. We've known for a long time that aluminum exposure is a risk factor for Alzheimer's as well.
And how do you get? I mean, probably some metal involved, right?
Yeah, there's different ways. It can be, and when we get results in testing, it's not even a reflection of a recent exposure. It can be exposure as far back as childhood to these toxic elements. And so it can be based on food, water, environment when you're younger. If a person has been a smoker in the past or the present, or like me and some of you, I was a professional secondhand smoker my whole childhood, right? Mm-hmm. I remember the living room cloud in the evening,
my gosh,
and it's
yes.
fun as a kid to go through and let's go ahead and play with the cloud, right? And or if a person has a job or a hobby where they work with metal materials, grinding, soldering, there's likely exposure there. Then you get into the more controversial of things, like the more of the metal amalgam fillings that you have. As we were younger, they were almost always like a mercury amalgam filling, so that can leach off and absorb through the mouth and the tissues and get into the body. And again, it's not just exposure. Some people are just more sensitive to a small exposure as well. So some people can have a big exposure, they don't feel anything, right?
What about deodorant? Wasn't that?
Yep. So for aluminum, that's one of the more likely things would be the antiperspirant portion of the deodorant. That antiperspirant piece is almost always some kind of aluminum compound as well. So you have to, it's easier to find out like aluminum free as well.
Yeah.
Yep.
I have another question. How about turmeric?
Turmeric is great. So turmeric and curcumin, a couple of the best natural or herbal anti-inflammatories. Curcumin actually has more research on it as well, but turmeric or turmeric can also be very good to do that too. So for most people, that can be a very good thing. I've seen a handful of people where they had a sensitivity to turmeric, just like they do to other foods as well, where they had some pretty strong reactions. So just know that that's a possibility as well.
Who takes turmeric?
I do. Yeah. I'll try to get it in system.
And should you take that in the morning or at night? Or does it not matter?
I don't think that one matters. Yeah.
I completely got rid of all my arthritis pain in my hands. Since I've been taking it for the last year, I have zero pain in my arthritis in my thumbs.
Rheumatoid?
It never technically diagnosed,
Confirmed?
but
Okay.
my mom and dad are both full of it. So,
Really? Okay.
How much
But-
do you take, Shelley?
I take two, so I don't know if that's 10,000
They're
or
the Costco
15,000.
ones, right?
Yeah, two of
The
them
white
every
ones?
morning, and I have not had any arthritis pain for
It's
the
a
last
Costco
year.
one, it's about
Yeah.
this big.
What do you take, Shelley? I didn't hear you.
Turmeric.
Oh, okay.
Mhm.
Costco actually has a very good turmeric.
Hmm?
So
I have such a
Yes.
hard time taking pills. It's like I gotta
Do you have
take.
any questions?
I had two boxes. They're huge. I feel like what this is telling me too is like I feel like we all. And you brought this up first. It was the first question. Like I hear something and I jump on the bandwagon and I'm like, okay, I got to try this. And sometimes I'm like, I don't even know. I'll try it for 3 months and then I'm like, do I have to buy that thing again? And when it's like
We don't know.
it's like a revolving door of things,
Right.
and and so I think it's like this makes so much sense. I literally said I'm going to up my HSA to the maximum because
Yeah.
I feel like why have I been avoiding just figuring out the things? Like
Mhm.
focus on the stuff I know for sure is a problem instead of the thing that it might be helping something.
Mhm.
But I
I've-
think our culture doesn't, they don't teach us that, they don't lean into that, they go after more of a reactive,
Treat the symptoms.
right, do the pharmaceuticals for years versus correct the problem.
Right. But I am, to your point, it's so interesting. Some people have a reaction to it. I remember when celery juice cleanses were the rage. And I did it and I felt awful. Like, I was like, I feel awful doing this. And I kept thinking, oh, there must be some purge and blah, blah, blah. But I literally couldn't do it anymore. I felt so terrible. Stopped, immediately felt better. Did my mail-in food sensitivity. And what came up? Red. Celery.
Mhm.
I mean, it was like it was like a year later, and I had avoided it because I was like, God, I felt terrible. I think I'm going to avoid celery. And it came up red.
Yeah.
It came up red. So I'm like, celery juice cleanses are probably good for some people.
Yeah.
To your
Oh,
point.
they can be,
They're
yeah.
not great. But for
And-
me, it was awful.
And that's the irony is a food sensitivity, even allergy, but so look at the difference. So a true food allergy is people, they have it's an immediate onset reaction to like seafood or strawberry or peanuts or shellfish or whatever, right? And that can be like a medical emergency. That kind of food reaction really makes up probably less than 5% of the food reactions. The majority of food reactions are a a delayed reaction that we call a sensitivity. It's still an immune system reaction. It's a different part of the immune system. It's just that you eat it, and it's not immediate. It can maybe take a few hours or maybe a few days. Or to make it more complicated, it can be dose dependent. So I'll pick on dairy because it's a common one.
Yeah.
So a person has a little bit of dairy on day 1 and they seem fine. They have a little bit on day 2 and day 3, and it's not until day 4 they get enough built up into their system where they cross the threshold where now it becomes a trigger, right? Most people logically will look back at that and say, well, I had that the past few days. That can't be the problem. But it could still be the problem. And it can be literally any food. It has the potential to have a reaction. Remember, I had one lady a while ago where her top 2 food reactions were spinach and blueberry. And so you think of these as very healthy, nutrient-dense kinds of foods, but for her, it's almost like putting a toxin to her body with how her body's reacting, right? So you could argue that pretty much everybody would benefit from doing food testing because there's a chance we're all reacting to something that we don't know about. And let's say if like in a community everybody did food testing, that would immediately like wipe out a certain percentage of symptoms just by doing that one thing alone as well, because it can present as almost any kind of symptom that you can think of as well. So yep.
I had another question. You had, when I first talked about the thyroid, you had something about the liver.
Mm-hmm. So the liver is surprisingly important in having healthy thyroid hormone. So the thyroid produces mainly T4, or in your case, you're taking a T4 or one of the T4 medication. But T4 actually doesn't do that much to determine your metabolism energy. It's not until T4 gets converted into T3. So about 80% of that conversion into T3 takes place within the liver. So the liver is super important for converting T4 into the free T3. So if the liver's stressed,
How do you know? How does one find that out?
lab testing. Yeah. So within our testing, it's part of medically. It's part of what they call a metabolic panel. They're doing testing of liver enzymes. So AST, ALT, GGT are the abbreviations of those, and those can give you a good read. However, the liver is a super resilient organ, and the liver has to be struggling quite a bit before we see those enzymes start to alter as well. Yeah. Along that thought process, for conversion of T4 into T3, the critical nutrient needed is selenium, a trace mineral that's needed for proper conversion of T4 into T3. So we see people where their T4 is great, their free T3 is low. That's a conversion problem. They have plenty of T4. It's not converting to T3 very effectively. So the critical nutrient needed is selenium to facilitate that conversion into the free T3.
Interesting. I've been on a selenium kick, right? Because I read about it.
Brazil nuts?
Brazil
Yep.
nuts.
One of the better food sources. I talk about Brazil nuts quite a bit.
Yeah.
Yep.
I read about it, and it's also good for inflammation, I think. And I was like, ooh, I'm just going to try this. But that's easy.
I force myself to eat walnuts because I hear a lot of things.
Yeah.
I don't do fear.
Yeah. Well, and that's the thing is I'll have patients that'll come in that literally will have a grocery bag full of supplements that they've tried over time, and I think it's human nature of some people. It's like they want to do things, they want to kind of figure it out, but you get to a point where it's like, I don't even know if this stuff is helping me. It's like, what do I really need to do, right? And that's the whole point of doing better testing. It helps you prioritize and know these are the things that are the most important to be working on right now as well.
And
Plenty.
How much money have you spent on all these other supplements
Yeah.
that don't do anything?
Yeah, exactly.
But you hear it's the new thing, or do your celery, do your walnuts. You probably spent $1 million on all this other stuff, or you go get tested and find out.
What about ashwagandha?
Okay. Very good for stress and kind of like out of nowhere random question. But it's a good question, right? You'll see ashwagandha as part of a lot of like adrenal or even more hormone side related things, or even products that are more about like stress or helping with stress. So ashwagandha is what's called an adaptogen. And so what an adaptogen is let's say adrenals are either overfunctioning or underfunctioning, an adaptogen will help gravitate towards normal, whether it's over or under. Adaptogen helps normalize either way. And so, yeah. And so, so for most people, they would see benefits from that. Yeah.
Are there supplements that you would just across the board say are good for almost everybody? Like, you know, fish oil, vitamin D for those of us in Minnesota, right?
Yeah.
Like
Yeah.
those things. I mean,
So if I look at like the most common ones, again, magnesium is one of the most common mineral deficiencies, and so I'm pleasantly surprised when I see testing and magnesium is okay. And that's interesting too, because magnesium can test okay, but some people can still tell they feel better and sleep better when they're taking magnesium, even if it's okay in lab testing, right? And you're right about vitamin D. It's very common to see vitamin D low, especially as we get in the wintertime. Vitamin D,
Is it true that you should take K with it?
yep. So vitamin D3 with vitamin K. And the reason is, so vitamin D brings more calcium into the blood, but we don't want that calcium going to the wrong tissue. We don't want calcium going into blood vessels, contributing to hardening of arteries and that. So vitamin K acts as a director, telling calcium to go to the proper tissue and not the wrong tissue. So vitamin D is important for blood sugar control. Your pancreas needs enough vitamin D in order to produce enough insulin. Vitamin D is important for balance of female hormones, balance of brain chemistry, huge immune system benefits. Vitamin D seems to be more of an antiviral benefit. So when your vitamin D levels are at a good level, if you're exposed to cold, flu, COVID, whatever viruses, you're less likely to get sick from that. I would argue the most important benefit of vitamin D are the cancer protective effects, in that vitamin D is very powerful in preventing or suppressing cancer cell growth as well. When you look at what is really considered ideal from a functional medicine perspective, testing of vitamin D to be in a range of 60 to 80 is where you will ensure you're getting all the health benefits that vitamin D has to offer. The exception to that is if somebody has had any personal history of cancer of any kind, or if they have autoimmune, then I would tell you, or that person, that your range is actually 80 to 100. Again, because vitamin D is very powerful to prevent cancer cell growth, but vitamin D is also very powerful for taking an immune system that's kind of gotten out of control in autoimmune and help better regulate it under better control as well. So the lab reference range provided by labs is usually 30 to 80 or 90, right? So many people are testing in the 30s, they're being told by the provider that their vitamin D is okay, when in reality it's in the range of the lab, but it's not where it needs to be to get all the benefits that vitamin D can do for you, right? As well. Yep. And some people, they need to supplement vitamin D in the wintertime, but they get enough sunlight in the summertime, and so you don't know unless you're testing both time frames to know what your body really needs as well.
So I'm going to do a balance. Say, what about calcium?
For what now?
Calcium.
And what about it?
I've heard that menopause, you should be taking calcium.
Well, yeah, well, it makes sense because in menopause, estrogen levels drop down. Estrogen, in terms of bone density, estrogen slows the breakdown of bone tissue. And so that was the idea a long time ago in hormone replacement was to help prevent that breakdown of bone tissue so bone density would stay better. The other piece of that is progesterone, testosterone, DHA actually help you to build new bone tissue as well. So bone density is not just an estrogen thing, it's all the hormones as well. But if there is a concern, and typically, you get your bone density testing done, you're told you have osteopenia or osteoporosis, definitely you want to be getting calcium. The form of calcium matters, just like the form of magnesium and other things matters as well. So like calcium citrate would be kind of low on my list. There are other forms of calcium that are better. One of the better forms, if not the best, it's abbreviated MCHC. It's just microcrystalline hydroxyapatite complex, right? Who cares what the name is? It's just MCHC, because that calcium most closely matches the matrix of bone tissue. But then it's calcium with vitamin D, with hormones being balanced as well. Some women do not feel good, like it really upsets their stomach to go on the bone density medications, right? And so there are some natural equivalents that can help with that and not have the side effects that like a Fosamax or Boniva or all these medications for bone density can do as well.
Can I ask just kind of a random, kind of, I don't know if it's getting off the lane, but like red light therapy.
Mhm.
Do you feel that's a beneficial thing?
Yeah.
Is there any harm in that?
I don't know if there's harm actually. I haven't heard of it. I think it's. I would say I don't know of a downside to it necessarily. The wavelength, will penetrate a little bit deeper into tissue depending on the wavelength, and it can help reduce inflammation, which can be good in a healing process. It also helps to activate the mitochondria. So these are the parts of the cell that actually generate units of energy. And healing is an energy-intensive process as well. And so when you can do things to get yourself to produce more energy, you not only just have more energy, but then that can facilitate healing within the body as well. It can also help facilitate just general detoxifying of the body too. Yeah. So
that now ventures into what feels like so much overwhelm to me too, which is, have you guys watched what's his name? I can't remember. He's the Venmo dude who built and sold Venmo, and he's literally trying to not die, and he spends every penny of his money trying to. It's a whole regimen that takes like 10 hours a day.
Yeah.
And I've watched his documentary sometimes, and I'm so overwhelmed.
Like longevity.
Yes.
Yeah. He's kind of making himself an experiment in a way.
Yes, he is. He's trying to,
and he's
reversing his age. It's insane.
He is, yeah. And he's going to extreme lengths. He has all kinds of equipment and technology, and he has tons of money. He can do this, right? It's not what most people can do, but he's doing it, I think, for himself, but also for like the research to see what are the variables that seem to be the most beneficial, of which he found olive oil was one of them.
Yeah. But we're just finding this out. Right.
They won't stop.
We need to dumb it down for the average person.
Yeah.
Who can't spend that kind of time and money.
Exactly.
Yeah, like the top 3 things or something.
Right.
Because you can do all those.
Right. You can spend a lot of time, a lot of money going on rabbit holes of things and not really knowing if it's going to be that beneficial too, right?
Yeah.
So kind of the bottom line is really to get tested
Mhm.
to see what you need and where you're
What
at.
benefits you the most, right? Because
Right.
the top 3 for Diane might not be the best for me.
Right.
Right.
That's one of the easier ways to take out the guesswork, right?
Stop spending money on all this other random stuff you hear about.
Mm-hmm.
So the process was you fill out a questionnaire, you analyze it, and then based on your symptoms, he's going to kind of customize your super panel, maybe plus some stuff.
Yeah, because we do, in terms of testing, we do that larger blood hormone super panel testing is a common one. We do testing for heavy metals, we do food sensitivity, we do digestive lab testing, genetic testing. We do different kinds of testing. So initially it's figuring out what testing makes the most sense for each person. And so the process normally starts with an initial consultation. We do this at no charge for anybody the first time they're coming in. It's just a conversation to talk about really what's going on for your symptoms, what are you looking for, kind of explain what the process is. If we do testing, this is what it looks like. And one of the things that I'm proud of in the clinic is that we're extremely like low pressure, if no pressure. It's just a conversation, and then educate you, let you do what you want to do, kind of thing as well. And then if you want to move forward, then we would love to help you do that as well. And then so then after the consultation, you fill out the questionnaire. It's a detailed questionnaire. It's I would say it's even a little bit tedious, but it saves us from having to ask 1,000 questions, right? So it's more time efficient that way. We do like it if they have any results of lab testing over the past few years, if you're able to get us copies of prior labs over the past few years, if you even have any, because it does help to see what's been tested and kind of the patterns of things and kind of compare that to the new testing. It just helps kind of fill in some of the gaps or some of the blanks that way too. That way, when we do the initial testing, we can make sure we're doing it like the smartest, most cost-effective way for each person as well. then whatever testing makes sense, get the testing done. Once all the results come in, the staff will contact you, and then we'll spend quite a bit of time sitting together one-on-one, going over in detail those results so you understand it and why we're recommending the things that we're recommending there too.
So our like line chart, does that have a test result?
Usually,
Yeah.
most people will go in their My Chart and they'll either download PDFs or do screenshots and just send it to us by email. Yeah, as well.
So do you have business cards?
No.
What's your
That would be that would be too forward thinking of me to bring business cards, right? So I have a website though.
What's your website?
So it's healingchoices.com basically. Yeah, can learn all about all the different stuff that we do there. And I was talking about this education tab. So I was talking about this seminar I used to do that was really popular called Mastering Hormone Balance for Women. I actually did it as a webinar and I recorded it, and so that's on there. You can watch that. I did one just on thyroid as well. May interest you. It's free to watch. Just gotta go into it that way as well.
I will say again, I kind of went to a meeting a year and a half, 2 years ago.
Yeah.
And the information was great. It was the baseline, but it was on me, and I did not implement consistently.
Mm-hmm.
But I'm going to revisit you and
Mm-hmm.
start over again. Now that the pain is
Yeah,
more
that's
intense.
yeah. That's human nature. I think most people, they have to, and you described it as kind of the pain point. They have to get to a point where it's like, I don't want to live with this anymore. I don't like how this feels, right? And but that's part of the reason why, as we work with people, and we start out in like a 3-month program because we're meeting with people at least every other week, sometimes every week, because some people, honestly, they need the accountability. They need, if you want to call it hand holding, they need someone to kind of walk with them and kind of walk them along to make sure that they can see results. That's why we do it as a 3-month program. We used to do it where it was just a monthly thing, but then people were not following through and not getting the results that we know that they could get. And so, and we're driven by getting results for people, right? So that's why we do it that way. Okay.
So if you're a person who likes a little bit more natural things, like I went to a gynecologist 3 years ago and he's like, I was having all these issues, and he's like, well, come back when you are in this state and we'll get you tested again and then get you on hormone therapy. And I'm not really for hormone therapy, so is there, like, could you do the testing, right, and then get more of a natural process instead of, hormones is the way to go?
Right.
I don't always think that that's always the best answer.
Mm-hmm.
It might be, but
Yeah, and I guess it depends on symptoms. It depends on what the testing actually shows, right? It might not be the right answer. But keep in mind, and I don't know if this applies to you or not, but if you're not yet in menopause and you're not getting those symptoms, it's still a function, the long-term success for all women for having healthy hormones, having good adrenal function, right? And so even just by paying attention and doing the right testing to know how the adrenals are functioning and if they need to be supported, in theory, then the adrenals are working better. So going through that transition in the menopause should be a smoother transition with fewer symptoms or fewer issues in that sense too, right?
yeah. So I'm perimenopause.
Yeah.
It sucks. It's like, that's why I bought an Apple Watch 3 months ago, because I can't sleep at night because and I wanted to clock to check it out, and I'm waking up with night sweats and having hot flashes. No, I've been doing that for 3 years now. Right?
She's the baby of the group.
But I've been doing that for 30. I'm only 49.
Well, okay, so you're 52.
My perimenopause or menopause symptoms started at 42.
Yeah.
I'm post now at 52, but your blood work will show exactly where you're at in the menopause stages.
Right.
So when I had Jace, my youngest, we did IVF, and they said, you're going to go through it a lot quicker than most people because you're already like towards that stage. So
Mm-hmm.
so yeah. So I started going through it, and like it just, it's horrible. And I've been doing it for like 3 years by myself, trying to figure crap out, just to get through it.
Yeah, so textbook kind of normal time frame for women, and you might know this is kind of late 40s, early 50s. What we see, we'll have women come in that they feel like they're starting to go into menopause in early 40s, even late 30s. What we interpret that as is that is reflecting the severity of their hormone imbalance at that age. And as their body gets healthier, as their hormones get healthier, then that gets better, and then they're back on track to the normal biological timing. Yeah.
I'm sorry.
Yeah.
I mean, because I went into menopause in my late 30s, and I was done. I tested postmenopausal on my 42nd birthday, and so somewhere when I was 41, and I found out later. I just can't believe that. Sorry, because I found out later. Actually, there are actually like bad things that can happen. Like that is early menopause. And it's not. There are a lot of things that they test me now for because they're like, it's not a good thing to go to menopause that early. It's bad for you.
And that's why they would be like, oh, you should go on hormone therapy because you don't want to go there. Because my mom had passed away from fallopian tube ovarian cancer, right? Probably other issues.
Although I think what age were you? Because that's pretty normal, late 40s.
When I had Jace, I was 35.
Yes,
And
so that's
when
exactly
I was 35,
why.
they said, hey, you're gonna go into hormone decline earlier than most. So, but I'm only 49. And
it just started, but still, no, it's just
like
makes me so. Had no idea. I could have stopped it. I was in a panic because I thought, I think this is too early.
It is too early.
Yeah. You hit the reset button.
You know what, though, I will say is that my menopause back then wasn't that bad. The symptoms weren't that bad. So when you said earlier, it really resonated with me where it's all the other things sometimes. Because now that I'm in kind of a forced menopause situation because of the medication I'm on, I'm having such much more severe symptoms. And I'm like, why didn't I had symptoms, but they weren't severe. I think my body in some ways could handle it because I was younger. I don't know.
Typically, if a woman, as they're going to menopause, if they're already estrogen dominant, their body's already dominated by too much estrogen, then I find it seems like it's a smoother transition because it's not like you're starting from a level and you drop down a lot faster. You're starting out at a level of estrogen that's already way too high in your body. And so it's a little bit of a smoother symptom-wise. It can be a little bit of a smoother transition, maybe not as strong of symptoms as well with that.
So I just want to circle back on the process for people that are thinking about working with you. So you meet, you do the questionnaire, and then you give them or send them out a box.
Yeah, so the larger, again, I'll go back to the super panel as a more common example. So our staff will order that panel. The lab will ship to your home address a box as a test kit. And once they have that, it's a matter of getting the blood drawn. We don't draw blood in our clinic. We're in Elk River. We recommend a lab in the city of Rogers. They're very familiar with the testing. When you have a test kit like that, even if you go to your own medical clinic, they're probably going to charge you some kind of fee for the service of the blood draw. In this lab in Rogers, it's like a $30 or $35 fee, but they make it super easy and they do it properly as well. We've had people that have gone to their local medical clinic and I don't know how they mess it up, but they don't draw everything properly or they don't process it right, and then they have to go back in for another blood draw just to finish the original testing, right? As well.
But on the website, it'll tell you where the other labs are.
Yeah, we give you a sheet of paper that tells you where the labs are too. So.
And there's little freezer packs. So freeze them before the day you're going to go in to the lab.
The lab usually already has frozen there too, so don't stress out about that too much.
They had some. Oh, don't worry, people do it all the time.
Yep, and so I guess that like super panel testing from the time you get your blood drawn takes about a week and a half to get the results in. But then if we have other testing, we have to wait till all the results come in, and then we contact you to let you know and set up a time to go over all that together and go from there. So
Do you have 8:00 tomorrow morning open?
You work after hours.
So, but with that in mind, it isn't like, it's like sometimes you try to get an appointment with a specialist and it's like 6 months down the road before you can even get in. It's never like that. Again, we're very efficient at what we do. And so usually within a week or two, you can get in. Probably even within a week, you can get in as well. So, yeah, easy.
Well, thank you so much for all the
Great.
Yeah.
valuable information.
Yeah, you're welcome.